Fetuses with congenital heart disease, CHD, are at increased risk of pregnancy loss compared to the general population. The aim of the present study was to identify pregnancy loss incidence, timing, and risk factors in major fetal CHD overall and by cardiac diagnosis. This was a retrospective study of fetuses and infants with major CHD. Pregnancy loss incidence and timing were recorded overall, and by CHD diagnosis with stratification by isolated CHD versus presence of an additional fetal diagnosis. Overall, 3,120 major CHD cases were included. There were 2,956 live births and 164 pregnancy losses, which occurred at a median of 27.3 weeks gestation. 59% had isolated CHD, and 41% had an additional fetal diagnosis. Among cases with additional fetal diagnosis, 58% had genetic diagnosis, while 42% had extracardiac malformation. Observed pregnancy loss incidence was highest in hypoplastic left heart syndrome, double outlet right ventricle with normally related great vessels, and Epstein anomaly. Variables associated with pregnancy loss included female sex, Hispanic ethnicity, high drops, additional fetal diagnosis, atrioventricular valve regurgitation, and ventricular dysfunction. Pregnancy loss risk is higher in major fetal CHD compared to the general population, driven by CHD type and additional fetal diagnoses. Recognition of pregnancy loss incidence, risk factors, and timing may inform patient counseling, antenatal surveillance, and delivery planning.